Guys, welcome to the show. Today we have on the show someone that I have heard of more than I know. I've only gotten to know her really recently through a series of emails and a couple conversations. But obviously, in the community surrounding my office, this woman has done some really great stuff. She's been doing it for quite a while. I love experience. I think the ultimate test of anything isn't always research. Research is obviously fantastic, evidence-based medicine, blah blah blah. But let's face it, I mean, when you're in the trenches doing what you do every day, you learn and you take everything you know and every day apply it to all the different bodies that come in your office and you become better at it. That's how I am where I am. Some people like experience, other people want a cutting edge person right out of school. They both have gifts, right? My associate doctor is 20 years younger than me, and he has some techniques that he learned or is sort of his vein. And then there's sort of mine, which is the vein I started in with all the branches from hundreds and hundreds of patients over the years. The individual we have today is in that category. She's been doing this for a while, and that's my favorite kind of person to have on the show and to consult with. I love new ideas, but like my good friend Jordan Peterson says, most good ideas are horrible ideas because they're usually not even good ideas. They're old ideas that someone forgot about and now thinks they're new, and they were thrown out a long time ago because they were bad. So I think it's funny when people overdo the new ideas thing. Not that I reject all new ideas; they're interesting, but put someone in a room and ask them for 10 new ideas and watch how bad all 10 of them probably are. So anyway, today we have on Dr. Donna Gullikin. She is Doctor of Physical Therapy, which she can explain a little bit what that is. She's got board certifications coming out her ears. She's a fantastic reputation in the community in Western New York, runs a couple clinics, and has been working as a physical therapist and doctor of physical therapy for years. So let's get started. Donna, how are you today?
I'm very well. Thank you, Dr. Mike. It's a pleasure to be here today, and I'm excited for the opportunity.
Fantastic. Let's start off by you telling me about yourself. I read your bio, and maybe you want to hit the highlights of that so we got an idea of who we're talking to. And then,
Sure.
then I got some questions.
Okay. Excuse me. I graduated from Damon College with my degree in physical therapy in 1984, and subsequently went back to Damon and got my doctorate in 2005. My business partner and I, his name is Peter Young, we opened Ortho Sports Physical Therapy as a private practice in 1989. And have grown into 2 locations with multiple employees. So we've been doing it for quite some time. And as you mentioned in your intro, sometimes, our newer hires come in with all these new ideas, and it's a lot of it is the same stuff that we learned 35 years ago, but just has a different name and a different approach attached to it. So the old stuff is new again, and the new stuff is old again, and we utilize both, I think, and do it well.
Absolutely. I think the same thing goes in my office. And, one of the things that I think I like to hear from any guest on my show is what got you started. Most people know that my situation was, mind-numbing migraine headaches that they danced me around, and I ended up in a chiropractor's office and had amazing results and said, wow, that guy's pretty magical. I think I want to do that. I was going to be an engineer at that time. I was my first year in college, and changed my major immediately, and off I went. So what got you started in physical therapy? Do you have like a sports history or an injury history?
Yeah, it's interesting. It's a great question. And when I used to interview prospective PT students, probably the vast majority of them had some kind of episode, either a sports injury themselves that they had to have physical therapy for, or maybe grandma had physical therapy after having a stroke, or some exposure to the profession over the course of their young lives. In my particular case, I was signed, sealed, and delivered to go to phys ed school. I was going to be a teacher. That's all I ever wanted. And you couldn't have convinced me any differently than that when I was 18, 19 years of age. When I was in my second year of college, I started at a community college, which made my mom very happy because I think she probably had some presumption that I was going to change my idea of what I wanted to be at some point in time. To this day, I could not tell you what made me change. to physical therapy, other than something told me I knew I didn't want to do basically the same thing over and over with just a different bunch of kids for 40 years.
Mhm.
And I am old enough that back in our day, you found a profession by looking at what was called a career catalog. So when I realized that I didn't want to be a phys ed teacher for the rest of my life, I pulled out a career catalog and looked for something that had similar ideas, similar um, uh, uh, concepts of what drew me to phys ed. There was the teaching component of it. There was working with athletes component of it. There was general health and wellness component. And so I literally picked physical therapy out of a career catalog, applied to Damon's PT program, was accepted, and the rest is history. There's no doubt in my mind it was the right choice for me. I think I would have been bored eventually with phys ed. I still miss having the summers off, like I would if I were still teaching, if I were teaching. But other than that, there was no turning back once I got into it and realized where I was heading.
That's fantastic. One of the things that you talked about a career catalog, well, we had, our guidance counselors would have us take a test. We took a test and we'd mark off all the things like, could we tolerate this, or do we like this, or that kind of thing. And I can remember one of the questions, and I may have said this in another podcast, but one of the questions was, can you tolerate strong breezes? And I'm like, well, I have no idea how cold, I'm a man of science. I want to know the exact wind chill and what am I dressed in for how long. I don't answer questions, that simple, but I thought, whatever the thing is, I want to know what that is related to. Like, what profession is out there? Is it forest ranger? I mean, what am I doing? If I'm doing something really cool, I think I could tolerate a strong breeze, but if I'm, doing something boring, that's going to be horrible. So after I took the test, handed it in, and I said to the counselor, I'm like, what's with the strong breeze one? He didn't know. A couple days later, he got back to me. He said, airplane pilot.
Oh,
And I thought,
seriously?
man, I'm thinking, I don't know if I trust this test anymore, because there's windshields now. I mean, was this when they had the Snoopy goggles and the scarf and they had two winged planes flying around? So I'm like, this is ridiculous. I like fixing stuff, and off I went to, start an engineering sort of background, and then said, that this is really, it was kind of dull. I'm more of a people person than that. So I thought, migraines, and off I went. So, yeah, I think that's, it's great when you discover what's in your blood. I have 3 daughters, and they're all trying to figure out what they're going to do. And some of them know and some of them don't. And it's kind of torturous when you don't have a passion. It's so great to have something that you're really passionate about. I think one of my things is, my biggest passion probably has to do with introducing natural health care to people so they don't have a drug dominant. The drug industry to me is sickening, and the way it's handled and the way it's pushed and the way so many physicians are stuck in that's their only answer. Or patients believe, what's the pill I should swallow, versus taking the effort to rebuild yourself properly in so many ways. So that's cool. So question, physical therapy means a lot of different things to people. I have to define the difference often between physical therapy and chiropractic for my patients, because they'll come in with maybe an extremity thing. In New York State, we really can't bill for an extremity work. Other states you can as a chiropractor, and I still work on the extremities. I'm allowed to work on them, not bill them separately. So on and so forth. And if I get somebody that really has a significant, say, shoulder problem, I love PT for that, because of all the ancillary musculature, the redundancy of the musculature in the shoulder. And sometimes the manipulation under anesthesia for adhesive capsulitis or frozen shoulder. It's all cool stuff that I don't do. So I do some mild work on that. So tell me, to you, what's physical therapy? Where does it shine?
I think, physical therapy to me is a form of medical treatment that basically helps people to move better, reduce their pain as a result of that improved movement, and ultimately live better. Our mission statement actually is we help people heal naturally and live a better life. So it's non-invasive. It requires no medication. So those two things that you hit on in the beginning of your statement to this question, we agree 100% with. Too often people turn to pills rather than use their own body to help alleviate their symptoms and their pain. So often it's a muscle imbalance or a movement pattern. And that's what we're primarily trained in, is recognizing movement of a patient. So if you make that correction, oftentimes their pain goes away. It's sometimes very, very subtle. People think that physical therapy is going to be painful, and there may be some discomfort along with it, but only because your muscles haven't been doing what they're supposed to be doing. So if there's pain involved, we're doing too much. If there's discomfort involved, that's to be expected. So again, just to kind of backtrack a little bit, physical therapy uses movement and flexibility and stretching to help alleviate symptoms, along with some other modalities that we have at our hands. They're not used as often as they once upon a time were. When I first got out of school, things were geared much more towards the modalities of physical therapy. And that's things like electric stimulation and ultrasound and moist heat and ice. We still utilize those things, but not nearly as much as we used to. And when we do use them, it's typically just to get people to relax a little bit, feel a little pain relief before we ask them to do certain movements. And sometimes at the end of a treatment, when maybe their knee is a little bit flared up after doing some knee exercises, just to settle that down a little bit before they walk out the door.
Yeah, and that brings up an interesting question. Do you prescribe medication? Do you have a license to prescribe?
We do not. That is not in our licensure. I don't believe that anywhere in the United States is it allowed in our practice act as physical therapists to be able to prescribe any kind of medication. I believe that there is a movement afoot to allow us to prescribe things like a Medrol dose pack, to recognize when that might be appropriate. Somebody comes in with something that's really hot and really inflamed and just needs that to settle it down before they can even start treatment. But I don't foresee that happening anytime soon. The AMA is pretty strong against allowing ancillary services to prescribe things of that nature.
Okay, yeah, I didn't know who was who would sort of head the or increase the likelihood that you would be prescribing, because it's a very similar thing in my profession. I think there's 2 states where chiropractors can get a license to prescribe. They take a class, take a test, and pretty soon then they're prescribing different medications. I'm fully against that in my profession. I voted against it. I've spoken to the dean of the school I graduated from, because he was going to put his sort of voice in and wanted to know what the graduates thought of that. And there's enough drugs in the world. I don't want to be pushing. People come to this profession for a natural answer. I don't need to be a one-stop shop. You know, it's just, to me, that it's a no-brainer kind of question for me, because, you know, the drugs are all over the place. They're not hard to find. I don't need to, the drug companies would probably love more salesmen, right?
Yeah.
So, you know, what sets you apart, your particular practice? Are there different disciplines within PT? Because there's 140 styles of chiropractic. People utilize like probably 3, and there's probably 20 that are somewhat popular. I practice 6 different ones. Is it similar in PT? Is there sort of philosophies or strict techniques that one will practice and one won't? And if so, how are you different, and which ones do you do?
I don't think there's so much of that in our particular profession as you're describing in the chiropractic world. There are some treatment techniques that are very, very specific, that I would say there's a handful of therapy practices out there that maybe just adhere to those. One of those is the McKenzie method. There's the Feldenkrais method. So those are just a couple of things that I can think of off the top of my head, and they're pretty rigid and pretty strict for those people that really truly believe in those techniques. There's nothing wrong with those techniques. We utilize portions of the McKenzie method with what we do with back patients and neck patients, and when it works great. But I think personally you need to be open to other alternate treatment ideas, because sometimes it doesn't always work, no matter whether you follow that. My business partner is McKenzie certified. So he certainly starts with McKenzie when he's evaluating a back or a neck patient. But if it's not working, then it's time to go in a different direction. And you and I both know that the textbook says this is the way it's always going to work. but the textbook isn't always correct. Human beings are different. Their anatomy is a little bit different. Their background's a little bit different. So you can't, I personally feel that you can't necessarily adhere to any one type of treatment. So in terms of what sets us apart from others in our field, and in particular in Western New York, we have an aquatic unit at our Harlem Road location. So we do have the ability to put people in a non-weight bearing, gravity eliminated situation so that they can build up their endurance, build up their movement, build up their strength without putting a lot of load on whatever joints may be injured. We also, at our Main Street location, have a class 4 laser that we've only had for a couple of years. And we're finding tremendous benefits with that for people with arthritis or real acute tendonitis to help settle that down again without medication and without surgery. In addition to that, our particular practice, we have never had PT techs or PT aides, whatever you want to consider that. We only have licensed professionals in our practice. So if you're being treated by somebody, it is somebody that has gone to PT school. Prior to the pandemic, we did have 2 physical therapy assistants, which is also a licensure that were employed by us. But unfortunately, because of the pandemic, circumstances changed and they ended up, we had to lay them off, and subsequently they have found employment elsewhere. So again, in our practice, it's only licensed individuals that are actually treating the people.
Fantastic. One of the things that I have played with in my personal life, in my athletic endeavors and my constant want to be superhuman is the, endurance and strength and the differences between the two. When you're building muscle for endurance and building it for strength, I tell a lot of my patients, one of the oldest things in the world for rehabilitating you is yoga. And yoga can build strength, and it also obviously builds endurance. You got to hold planks, you got to hold postures. And when I can talk a person into doing yoga for long enough, there's almost always a positive benefit. And I believe that comes from the endurance personally. Give me an idea in your practice when you think, okay, this person needs pure strength, this person needs endurance. Talk to me about the difference in those and how you utilize those kind of things and who gets what.
Well, I think that they're 2 different things without a doubt, but yet they're not mutually exclusive. You can't have endurance without strength, and you can't, to a certain extent, have strength without endurance. If you have strength without endurance, you're talking about power. And that's a person who can take one of those big truck tires and flip it one time, but couldn't do it a second time. So what good is that in a day-to-day task? Oh, great. You've got the ability to lift 200 pounds, but you can't do it multiple times. So how can you be a farmer and throw 50 hay bales into the barn over and over and over? So that's where you need endurance. And everybody needs a combination of the two. So when we're treating somebody, we probably, if they're very, very weak, we are focusing on strength first. And then we bring in the endurance component of things so that they can get back to doing those things that they love, the day-to-day tasks that require the combination of endurance and strength. If you live in a 2-story house and you have to go up and down stairs multiple times because your bathroom is on the 2nd floor, okay, well, you don't want to live upstairs. So you have to build the strength to be able to climb the stairs, but you have to be able to build the endurance in order to do it multiple times. Having a combination of strength and endurance also allows us to maintain good posture and stability over the course of the entire day, as opposed to just when you first get up in the morning. It helps you maintain good, healthy body weight, do the activities that you love to do. So without a doubt, we are working on both of those things, probably with almost all of the patients that come through our door, because over the length of time that their injury may have happened, or their chronic condition has worsened and they've not addressed it for 6 months, they have gotten weak and their endurance level has also decreased. So we're doing both.
Yeah, that makes sense, because I've worked with patients, different types of athletes, from marathon runners to power lifters, and they are, like you say, they're not mutually exclusive. You see the two one will lend itself to the other a little bit at least. My endurance people are a lot stronger than they look like they are because they're kind of thinned out because they're meant for running, let's say. And certainly my power lifters do not. They look about as endurant as they probably are, right? You just don't get in their way, right? There's some superhuman strength there. But I know, like, I like to build endurance in the low back. I find that to be something, more endurance styled exercises. I like people to hold extensions, mild extensions over Swedish exercise balls, 65-centimeter balls. Getting out, I read a really interesting article one time about fatty infiltration in muscle, and the difference between chronic pain and getting rid of your chronic pain was how much marbling or how much fat was in the muscle. The less, the better. You wanted that lean meat. You didn't want that marbled steak in your back. And that was achieved in this test by, in this research, by having people use the Swedish exercise ball and holding extensions, for, seconds and seconds. I don't think minutes, but, long periods of time versus putting a plate on their back and having them do 5 sets of 5 or something where it was more of a strength workout. And I thought that was interesting. The whole seminar was very PT-like. It was at a chiropractic seminar, but it was like, okay, how do you give a chiropractic patient some simple things to do at home, as long as they'll be compliant, and and get their backs to be rehabilitated. And that's one of the reasons I love PTs, is because most people are lost and into how to get their back better from a muscular standpoint and stability. And if they aren't lost, then they may not be compliant. They might do it for a couple of weeks and then fall off the wagon. And to go to you guys and have that exact instruction works out really great. I always saw the two professions as very complementary. I know I've heard other things, like I have chiropractors that think they do all the PT stuff and PTs that think they do all the chiropractic stuff, and I just like that attitude. Just a negative attitude to begin with. Plus, it doesn't serve the patient. What serves the patient? That's what we've got to be looking at. So
Agreed.
It's kind of ridiculous. One of the things that we do in chiropractic, we pay a lot of attention to the positions of vertebra and that effect on the nervous system, and loads of research on that. The founder in 1895 made statements about bone position and nerve pressure, and that if the pressure was on the nerve, and at that point he said it was a bone touching a nerve. And with more research, you realize that certainly that can be the case with bone spurs and significant oddities and distortion. Later, we found that a lot of the pressures were actually fluid retention. Other people went into this idea that it was the muscle tension was a static electrical field, and that was so close to the nervous system that muscle was somehow affecting the conduction of the nerve in a subtle way. And once again, we were back to having nerve pressure, and organs weren't running right because spine was distorted. Do you see that, or do you pay attention to that in your practice? Do you have a relationship to nerve pressure? Not only just big gross disc herniations and stuff like that, but even with distortions, bad posture. Do you see changes in that, and is that something you're sort of into?
We do, to a certain extent, and probably not as directly as you do in your profession, because we are not doing manipulations and/or / adjustments, however you want to term that. We do mobilizations, so we are doing more subtle adjustments from time to time. We also do apply some manual forms of traction, so both for the cervical region as well as the lumbar region, so we can open up some of the disc space and the foramen to allow a little bit more breathing room for that nerve root to come through. And beyond that, anything that we do to the nervous system itself is more a brain-body connection type effect of the nervous system. For example, it's not just your muscle's ability to move a body part if it hasn't been moved in a long time. Sometimes it's that the brain that says my leg can't move anymore. So there's treatments that we do that you put a mirror maybe in between a person's ankles, and you move the ankle that is unaffected, and you also tell the patient to try to move the affected ankle at the same time, and their brain is looking in the mirror to see the ankle that's unaffected moving. And while they're attempting to move the affected limb, that starts improving the mobility. So that the visual cue that the brain is getting that my body part is moving is a false cue, but it actually helps to improve that. And there's other
Mhm.
forms of that we do utilize, but that's a great example, I think, of how we affect the nervous system. Not necessarily, we kind of trick it into doing different things rather than doing it with our hands.
I say that when I'm doing, I'll do PNF stretching to people's cervical spines and rotation a lot because people just can't turn due to all the ligament calcification, mineralization, spurs, discs, all that stuff that you know. And I always tell people I'm having your body pay attention to contraction while I'm sneaking a stretch in. And it's interesting that the nervous system, one of our neurology textbooks had a great quote at the top. It said that, remember, your your sensations, your senses are not a copy of reality, they're a distortion of reality. And you think about optical illusions, right? You think there's a curved line and another curved line and it's sitting at a funny angle, and you think that one's longer than this one or whatever, and then you realize they're not. I think people need to be aware of, the senses we have they're doing a good job, obviously, amazing, but it's not an exact copy of reality. It's a distortion of reality. And in doing so, you can be careful with how you're proceeding and realize you're not always feeling or seeing what you think. People tell me they come in with back pain, they'll say I feel like I got 100 pounds on my back. Well, that isn't, you really don't have 100 pounds on your back, obviously, but the feeling is that, because the nervous system only has so many ways of communicating that it's not doing well, or it doesn't feel right. Another question I have is bone density. One of the things that came out in the 90s was the big bone density scare, and we started with bone densitometers and people supposed to be drinking more milk and eating cheese and doing weight bearing things, and their bones were going to come back and get thick again. And for some people, for a lot of people, that didn't work at all. And then they ended up sticking them on Fosamax, or now Boniva, and there were detriments to that because it's obviously as a drug. And I read some pretty interesting research about alkalinity and acidity in the bloodstream, and that if you alkalize the diet, making it healthier using alkaline foods, that the bone got thicker. And that's something that I recommend. I put people on alkalizing diets and also weight bearing. I'm not into dairy products. I think cows are not meant to be drank from underneath of. But at the same time, certainly mineral rich foods and, what I call real food, God's food, whatever you want to call it, a diet like that. But what do you do for bone density? Do you get into that? Are people sent to you and they say, oh, my bones are thin, or I'm osteopenic, I'm osteoporotic, do something for me? Are there programs at your office for bone density?
Yes, we do a combination of strength and resistance training with those folks. There's some pretty good science out there that shows that by pulling on those muscle attachments on the bone, it does stimulate some bone growth. And certainly weight bearing activities have been proven to increase bone density. And if not for nothing, people that are osteoporotic are at risk for fracture. We know that. There's no doubt about that. So if we do nothing other than work on their balance and their stability to prevent falls, that's huge for them. Hospitalization following a hip fracture can lead to all kinds of complications. There's lots of research out there that shows a hip fracture leads to death within a short span of time. I think it's a five-year span of time. So if we're doing nothing other than preventative activities to keep them upright and keep them stable, maybe recommend some kind of assistive device, we can certainly work on those things. And a lot of these folks have never, if they're 25 years older than I am and are female, a lot of them were never exposed to any kind of exercise. They don't know what exercise really is. So if we can get them doing just a real basic, simple home weight training and resistance exercise program, it can go a long ways to keep them healthy and living independently.
Yeah, you make a great point about making sure someone simply doesn't fall down. That right there, you're decreasing the likelihood of bone fractures because you're not, kissing the pavement. I think one of there's an interesting statement a long time ago that all man's problem come from his or her inability to sit quietly for 20 minutes in meditation. Right? It's a great thing, right? But I think all man's problems come also from his inability to joined back into the life of living in the jungle or the plains or in the real environment. And the generation that you're referring to, and this is why I'm saying this, that especially female in their 70s and 80s, they really didn't play sports. It wasn't something that was encouraged. It was probably discouraged at that point. And they never built the bone bank when they were younger, so they didn't have these thick bones. And even though they lived pretty physical lives, I mean, they might have used those ringer washers and done so much stuff by hand, like my grandmother did. My grandma was an exception. She was an exerciser, never an athlete, but an exerciser. And she worshiped Jack LaLanne. Her and I used to do jumping jacks to Jack LaLanne when I was a little kid. Also, one of my favorite people. I won't go on about it. I love Jack LaLanne. But he got exercise into the household in the 1950s, and everyone thought he was crazy. But you look back and now you see the benefits. And that generation really lost out, because you go a generation before that and life was so hard. You had to be physical. And you go back, 100 years, my God, women and men together suffered greatly. And in the process, at least built good bone density and stayed thin. They didn't die of heart disease back then, right? There were no heart attacks back then. And there could be other reasons as well. But yeah, to get that generation to become more balanced and build density in their body, teach them some basic things. I do the same thing with that generation. I have them do safe yet effective balancing exercises. And I get once in a while, I remember this one woman, I got her lifting weights and she just would laugh her head off that she was pumping iron because she had seen the movie a while back. And she would come in and show me her biceps and her triceps. She's an awesome woman. And we got her bones thicker. Yeah, I put her on an alkalizing diet, and she lifted weights, and her bone density changed, and she was in her 80s at the time. She was, but she got into it. She thought it was the greatest. She had a lot of fun with it. Before I define my difference between sort of chiropractic and physical therapy, I kind of want yours. Like if a patient, let's say a patient has low back pain, then they go, okay, my back hurts. And they go to the medical doctor. Their medical doctor could say, well, God, you're out of shape, so go to a physical therapist. Or he could say, you're in shape, but you're all jammed up and stuck and distorted, go to a chiropractor. Sometimes that's what I see currently. I used to only see medical doctors referring to physical therapists. And then when I was in practice, probably about 8-10 years, all of a sudden we started getting referrals from medical doctors for back pain and then for migraines. It was kind of cool to see that there was some respect for the profession, because our professions came rooted from very different places. I think physical therapy always came from a very sane and accepted place. I could be wrong. You can tell me if I'm wrong on that. That's my understanding. Where chiropractic came from, really the sidelines. It was esoteric and bizarre. And I think the primary reason is our philosophy was always very Eastern. It came, the majority of what we talk about and what we do came out of Eastern medicine, the world of acupuncture, because in acupuncture there was adjustments and forces applied to the body to enhance mechanics type of thing. But yeah, tell me how you see the two professions as different.
Well, I think what you had touched on earlier in the conversation is on target with that, where you work more directly with the nervous system than we do most of the time. You're doing more adjustments and working on that spinal alignment to allow the nerve roots to have that breathing room that they need to be able to talk to the muscles or eliminate pain. Whereas we utilize much more of the musculoskeletal system in our profession to help alleviate people's symptoms. And I think your comment earlier also is right on target with when the two professions can work together. I think is when we have the best possibility of having a good outcome. Because there are things I readily admit that I can't do with a patient that you are capable of doing. And I would assume that you could say the same thing about our profession. And I think when I first got out of school, there was definitely a headbutting between PTs and chiropractors. There was, without a doubt, you couldn't even say the word chiropractor to another physical therapist when I got out of school. And they'd be like, oh, no, it's voodoo. There's nothing behind it. There's no science. And I think that's the other thing that we've seen change over the course of the years of my practice. There is much more positive research that definitely shows the benefit of chiropractic medicine. And that's when you compare the Eastern philosophy to the Western philosophy, the Western medical world wants that research. They need that evidence-based practice information in order to say, yes, there is something to this. So I think that's where we've come a long ways in being able to accept each other's discipline, as well as to be able to find a way to work together, as opposed to say, that's a crack. We don't, there's business for both of us. You know what I'm saying? And I think that was part of it, was the fear of losing out to having to give business. Somebody's taking away the spine care that I know I can provide. Well, I can provide a certain level of spine care, but I can't do the same things that you do. So why not work together for the best outcome that the patient can have?
Absolutely. Because I mean, if you're really going to do this right, the patient's best interest has to be primary, not your own, right? And I had an amazing professor, and he used to love to ask us every class that would come in. He would have them define professional, and what is professional. And then people would say, well, people that do things really well, people that are highly educated. And he's like, no, wrong. He said, you're professional when your needs are secondary to your client or patient's needs. That's when you're professional. And I tell my staff that. I had a young staff member, fantastic person, but she had this horrifying boyfriend situation. She was in her early 20s. She would come in crying. She would, and I finally told her, and she liked to talk about how professional she was. And she was in certain arenas, young person figuring things out. And I one time took her back and I said, it's unprofessional for you to come in here emotionally distraught. And she's like, well, I'm still doing things. I'm like, when people look at you, they know something's not right. And I understand you got a lot of struggles. Everyone has them. But you have to leave those outside and come in and do it. And so when you're professional, you're really making sure that the patient's needs are above yours. I don't come in the office and tell people that, this hurts or that hurts, or I'm depressed, or I'm this or I'm that. None of that matters. They're not there to hear my woes. I do share a lot of personal stuff with patients, but it's usually positive stuff, adventurous stuff that I do, just small talk and that kind of thing. But I'm not going to sit there and whine, because it's their turn to whine. People say, I'm sorry to come in here all the time, doc, and tell you all the worst things. I'm like, no, that's my job, is to listen to what's going on in your life and see if it applies to your back problem, if nothing else, or to just the general misery you're having. I think emotions affect the body dramatically, and I like to look at how they do and tell people, okay, this is emotional stuff you're going to have to deal with too. It affects your body. I mean, if your cheeks turn red when you're embarrassed, don't tell me that emotions don't affect the body. I mean, you just changed the blood vessel diameter of your cheeks when you were embarrassed, and you did that how? You don't know. It's a reflex. You're trying to blend into your environment. That's what embarrassment makes you want to do, hide. And the environment's usually darker than you. So you're blending in, pretty cool. That's how we survived, right? So to me, that's important. One of the things you said earlier, and then you used the term that I like, that chiropractors adjust the spine. The term manipulation, we learn it in chiropractic college as non-specific, broad-based forces applied to the body, and it really comes out of the world of osteopathy. Historically speaking, and osteopaths may have changed, and I really am not up to date on that, but historically speaking, Dr. Still, who invented osteopathy, said that he was moving blood around. And in moving blood to enhance the health of the person, you were squeezing them and wringing them out in different areas, kind of like you would a dish rag. And I 100% believe that that's valuable. I talk about circulation all the time with my patients. Circulation of everything from thought to cerebral spinal fluid to blood itself. But a chiropractor's job, we are doing that as well, but is more specific. I'm trying to get C1 to rotate and laterally flex to the left, let's say, because it's a distortion in motion, or it's distortion in position. And if I'm going to be that specific, let's give it a better term, or a more specific term, or a term that describes that, and that's where we use the term adjustment. Yeah, I know in physical therapy, they talk about a grade 5 mobilization, right? It's pretty heavy and there's a thrust at the end. And I don't think I have a problem with that. It's kind of getting into my profession a little bit, but I've talked to PTs in the past, and they said, no, that we own that, we had that, that's our thing. Who did it first, who owns it, whatever. But I'd rather go to someone that does it all day than someone who does it occasionally, right? So that's why I don't rehabilitate muscle all day. I give people basic ideas that are sound, but I'm not going to take someone's shoulder and have them run through a series of exercises for a lot of reasons. One, it's not fully my expertise. You're going to be so much better at that than me. And secondly, I don't have the time in the room to do that. My visits are shorter because insurance says, hey, you got to get that person in and out of here and give them the best thing you can give them. And the best thing I can do is a very specific adjustment. to their spine. Great advice, nutritional advice. I don't, as you can imagine, I don't stop talking through the visits. Because if I'm in the room, hey, get the best out of me, right? I've been around a long time and I read constantly, so learn from me. I'm, like you said earlier about being a teacher, I'm a teacher at heart. You know, I'm definitely a chiropractor and I love what I do, but to me, opening up someone's mind to the truth is some of the most exciting thing. That's one of my main motivations behind doing podcasts like this and having like-minded people like yourself on the show, is to spread the good word about what health really is. You know, so we touched on this a little bit, but tell me about diet, like either your own personal one or what you tell people is good. Do you have a named diet that you approach, or do you have kind of like, hey, cut the processed foods, eat more of this? What do you think works? Like you say, you get an obese patient in there, and you know the weight's an issue. Do you touch on that, and what do you usually tell them?
I would say that's an area that's probably one of the more challenging things for us. We don't have a whole lot of nutritional background in our education. So if somebody in the PT world is making suggestions or whatnot, they have done some additional research or additional training on their own. Certainly it is a dialogue we have with our patients in terms of, you know, your weight is affecting your outcome or your current symptoms. And if you want to really truly make changes that you can sustain, you need to address the weight issue. I personally believe in my grandmother's philosophy regarding diet, and that is everything in moderation. There's no bad food on the planet. Typically, it's more of how much of it we put inside ourselves that's the problem. You know, if you go on a cookie bender and you have 5 cookies every night, every day of the week, you're going to have a big problem. If you have 1 cookie every couple of days, are you going to end up 50 pounds overweight? Probably not. But along with that diet also needs to come some activity. If I ate 1 cookie every single night and never exercised, I would gain weight. So that's my own personal philosophy. There are certainly things that I recognize with some of my patients that, let's say I have a specialization in post-cancer care because of some of my training and background. I see a fair amount of breast cancer survivors. I know that there are things that are very detrimental to them, so I will give them some advice regarding what they should eat or shouldn't eat, just specifically based on their diagnosis. If they want more detail than that, we refer out to nutritionists or a dietitian who I, again, also trust on that. So I would definitely say it's not our expertise and we don't have any specific recommendations. If they do want more information, then it's a situation where we refer out to people that we trust.
Gotcha. I think that's a very good approach. It's funny that you're so influenced by your grandmother, as I was. She's one of the most amazing people I've ever met. And her diet was probably similar to what you're saying. It was a moderation diet. She knew that, you know, fresh food grown out of the ground and good healthy meats were the staple. And then she had little, side things she would eat, you know, here and there. My diet is one of more extreme, you know, and I try to push people to, I tell people that if you can't plant it in the ground and grow something, it's of less value. I don't eat only that. That would be like the macrobiotic diet, right? But I say, okay, there's your top foods. Get a lot of that in. Do all that, good for you. And then after that, you know, I think I'm sometimes torn, depending how much I read about the vegan diet and carnivore diets and the extremes between those two. But you know, you look at some of the older diets, like in Chinese medicine and in China, where the meats were used as a condiment. You know, they were like flavoring things. And I think that's got to have, if I'm going to go with time-tested diets, you either are going to eat like the Mediterranean diet, something in like the Chinese diet, not American Chinese food. I don't mean that. I mean really the diet from China, which is different, similar but different. Or you're going to eat the paleo diet, because that's the diet of the caveman, right? And that diet has worked really well for me. I've done the paleo diet. I've never gotten into the zone and some of these other things. But when I first heard the paleo diet, I couldn't have been more negative. I'm thinking, here we go again. I've been through this. This is another silly diet. Someone in Hollywood's doing this. That's probably just genetically blessed, and they're claiming it's this. And then I read it, of course, and I thought, okay, that really matches a lot of the things that I say, that we should be eating from the ground. And so my smallest chant is eat real food. I mean, I think there's a lot of fake food in the world. If it's frozen, not so bad. Canned, not great. And if it can sit on the shelf in a box for a long time, there's something wrong with that picture. I think if it doesn't rot, even the bacteria don't want it. Either it's been chemically altered, or it's just really not food anymore. It changed too much. So that's my guidelines, at least with that. But it's yeah, I think that's the way to go. So one of the things that I always try to do on the podcast is give people something to take home and digest. And when I had a good friend of mine's a power lifter, if you saw that podcast, he's a neurologist, a power lifter, and a chiropractor. If you hadn't seen Fred Cleary, watch that one. He's a wild man. It's super intelligent, a little bit controversial, and very interesting. But I asked him this as well, and I knew his answer because he's a fanatic about doing squats. He thinks they solve all problems. So I'm going with like 3 home exercises that you think would just shape people up. Something pretty simple. It doesn't have to be super safe, but obviously safe. We don't want people pole vaulting. So what would you say are some 3 things that people can do at home to basically stabilize their body that would make a PT proud?
Funny you should mention squats. That's the first one on my list. Squats are very important for a lot of things. Getting up out of a chair, climbing stairs. So all the muscles involved with those basic day-to-day activities are involved when you're doing a squat. They can be done very safely by people of all ages. If you don't have a lot of strength and you just want to get started, you do a much shallower squat. And squats are not meant to be done very deeply anyway. But an older person can stand next to a countertop and hang onto the counter, so they've got balance and stability. People can sit at the edge of a chair and get up and down, just have their butt touch the chair, so that in the event that they fall backwards. So there's lots of ways to do that safely and get the benefit from doing a squat. So it's just important to keep the knee alignment the way it needs to be. So if somebody wants to look online to make sure of how they're supposed to be doing it, they should be able to pay attention to what position the knees are in. The knees should not go forward of the feet when you're doing a squat, whether it's a deeper squat or a shallow squat. The second one I would say that I love to give people for balance and overall stability and strength is a single leg deadlift. Also very, very good for balance. You're hinging at the hip, you're balancing on one leg, the other leg is going behind you, your arms are going down in front of you. You can do it weighted. You can also do that balancing, holding on to a countertop. It can also be done if somebody isn't strong enough to do it or stable enough to do it with a single leg. You start out with a double leg. So you just bend over at the waist, maybe put a dumbbell or 2 in your hands, and then stand upright. So you're strengthening your trunk muscles, your back muscles, your glutes, your quads are involved because they're holding you static as you're standing there. When you're doing it single leg, you're also incorporating your ankle muscles. And the third one that I would say, I wrestled with the third one to try to determine which one I like better. I like planks because those also can be done on the floor. They can be done against a wall. For people who are not able to get up and down from the floor, they can be done with a stability ball between them and the wall to make it a little more challenging. They can be done with extended arms. They can be done on forearms. But they also can be a challenge for people with shoulder problems or wrist problems that can be painful. So in addition to the plank, I also like what's called a Palloff press. If you haven't heard of that, that requires some resistance though. You either need to be standing next to some kind of a weight stack or utilizing resistance bands. So you anchor, let's say, the resistance band to one side of your body. You stand with your feet shoulder width apart. You grab a hold of that resistance band, you rotate it to midline, and then you just punch forward ever so briefly. So that incorporates your abdominal muscles, your trunk rotators, your shoulder stabilizers, your glutes, your quads. So it's a really great exercise to hit all of those things. And again, as opposed to a plank, is less toxic on the shoulders and the wrists if somebody has problems with those. But it does require to have a little bit of equipment in order to be able to do it correctly and get the maximum benefit from it. And
Yeah,
Palloff
those are
classes, you can find that easy online. It's spelled Palloff. So there's videos of that all over the place.
yeah, those are some great suggestions. Obviously, squat, deadlift. When you said single leg deadlift, I'm like, man, you're not messing around. That's some good stuff.
Mhm.
I do those, and those are difficult, especially when you do some weight. You do those weighted. The Palloff, it's called Palloff.
Yes,
I've seen that. I didn't know what it was called. I'd actually done it, but I didn't know what it was called because I
Mhm.
thought that's really I like the twist that's
Mhm.
causing, and I don't have to move my spine at all. I can just, like, as you put it out, it just gets harder because of the leverage of your arms being longer, and the easier as you bring it in. That's really great. I know the muscles that's getting after, and they're fantastic. I try to get all my patients to get resistance cords at their house. I tell them to get one with a handle and a carabiner, wrap the carabiner around and snap it on, stretch it out, tie it on, something sturdy, and do basic things to get their backs to, go. And I say, get online and look at some basic stuff. So,
Right, right.
yeah, I've sent links to people for sites with basic resistance cords 100 times by now, probably. I
Mhm.
considered selling them out of the office. I don't like selling stuff really, but sometimes the person just won't make the extra step, and you just got to have it there. So they grab it and walk out, and then they do it. And I find if people spend money on something, they kind of want to get their money's worth.
Mhm.
So I have people say, oh, do you like the ab roller, the ab flexor, and all this stuff? I'm like, I love all that stuff. I love it. It's great.
Mhm.
And what I'm really saying is, if you buy something, it'll stare at you, and you spent some money on it, so probably you'll do it. If I
Right.
just tell you to go do some crunching planks, you're like, well, I didn't, the commitment isn't there oftentimes. But if you're tripping over your ab flexor in the living room, you might once in a while start to use it. So, motivation and consistency are so important. One other question to wrap it up with you, and I want to thank you right now for coming out and doing this, because I think you're interesting, and I love, like I said earlier, I love all the data that's packed in your head over the years, like mine, we have similar packed heads. Um, I like to define. I love to ask, like, when I get a staff member I'm going to interview, say for a new position at the office, I always ask him, what is health and how do we heal? Because it really gives people, like, it gets inside their heads, because people say, sometimes really silly things about what is health and how do we heal, and other times really brilliant things. And I think it really lets me know how much time someone's maybe spent thinking about this. But I
Mhm.
think we should start from a premise of what is health, because if we're going to get someone healthy, and if we're going to get someone to heal, let's know what it is first. We got to understand what we're trying to bring on. So how would you sort of define those?
I think that's a really great question, because health is definitely different for everybody, I think. But I think if they really took the time to think about it, they would recognize that maybe what their perception of health was maybe wasn't 100% what they should be thinking about. To me, health is not only the physical health that we need to have, and that's not just, well, I'm so healthy I never go to the doctor. It's, are you able to do all the things that you want to be able to do? Now, certainly we have to give up some of that as we get older or different circumstances change, but can I live in my own house? Am I able to run with my grandchildren? If I'm coaching a ball team, can I still hit the ball to the outfield? So that's a component of it. The physical health is just a component of overall health, but there's also emotional health that feeds into it. There's financial health that feeds into our overall health. There is the 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 all of those things come together, and if one is off, if my finances are a mess, my overall health is probably going to be a mess, because I'm probably
Right.
eating the wrong things out of stress. If I don't get that in order, the rest of it isn't going to fall into place. If I'm emotionally a wreck, you gave the example of the staff member previously that was coming into the office, an emotional wreck on a regular basis. she was not doing herself any favors, and she wasn't doing her customer base any favors. So I think health to me is a combination of physical, emotional, financial, well-being, to be able to live the life that I want to be able to live. I may not have everything I want, but as long as I have everything I need, and maybe a little bit more than that, I think that's a good measure of health to me.
Yeah, and back to quoting my grandmother, she used to say, "If you have your health, you have everything."
Mm.
And anytime things wouldn't go right in life, one of her things she'd always make you remember is, "Hey, you still have your health, and tomorrow's a new day, and you're going to get some rest, and you're going to get up in the morning, you know." And I think that's very, very true. I remember listening to one of these very successful businessmen that everybody loved, a really good person, and they asked him, what are some of the keys to your success? And he said, "I go to bed and I wake up the next day, it's a new day. I don't bring yesterday in. I don't bring all the exhaustion, negativity, and frustration in. When I sleep, I wake up and it's a new day. And I'm gonna maybe be able to solve the problem today." Because remember, Einstein said you can't solve today's problems with today's brain. You need to solve today's problems with tomorrow's brain. So when you wake up, you're more likely to have tomorrow's brain tomorrow than you're going to have it today. So if you can't solve your problem today, you go to bed, preferably early, get up early. That's what I do. And you're going to have a fresh, maybe that future brain that's going to solve that problem from yesterday.
Yeah, and that's the other element of health that I was not pulling out was sleep health. That's, to me, is also another component that you have to have all of those factors all in place in order to really be a healthy person.
Yeah, I try to get people to master the fundamentals.
Mhm.
Emotion, water, thought, breath, as the very basics. And when you're moving and you're breathing and you're drinking water, you got a lot done. You got that body primed up, and then everything goes better when you got those in order, right? So, all right, Donna, I appreciate you doing this with us. I learned some stuff today, and I know my base of listeners have learned some things today. And I think it's great that you're on board with PT the way you are. I love your approach, and I think as I'm talking to you, I'm thinking of the people I'm going to send your way, actually, because there's a couple of patients that are buzzing around in my head as you talk that I think would fit you real well. So that's fantastic. I appreciate you coming out, and everybody listening, if you like this show, give it a thumbs up, share it with people. Dr. Donna is ready for you as well. I assume you're taking new patients. You're
Absolutely.
Good. Excellent. And your two locations are where again?
We have a location on Main Street heading towards Clarence. We're just past the intersection of Main and Harris Hill, heading into Clarence. And our other location, our flagship location, is on Harlem Road in Snyder, very near the intersection of Harlem and Kensington and Worley.
Fantastic. Not too far apart from each other. Awesome. All right, Don, I appreciate you coming out today and sharing all this with us, okay?
Thank you so much. It's been my pleasure, Mike.
Have a great day.
Have a great day.
We'll talk soon.
Okay. Bye-bye.
Bye.